Hi, I'm Alan Norton, Workforce Development Executive with the Pennsylvania Chamber of Business and Industry. 10 of the top 30 most in-demand careers in Pennsylvania are in healthcare, and 6 rank in the top 10. Just to keep pace with demand, Pennsylvania needs 6,000 new medical assistants and 19,000 new registered nurses over the next 7 years. There's also a dire need for surgical technicians, respiratory therapists, nurse aides, and many other healthcare roles that require just an associate's degree or a certification. Career and technical education schools are an excellent option to get you started on your healthcare career pathway. Today I'm joined by Shayla Thompson, Recruitment Manager with UPMC. Shayla, thank you for the opportunity to sit down and discuss the value of career and tech education in Pennsylvania.
Absolutely, thanks for having me.
So Shayla, tell us a little bit about UPMC.
Sure, UPMC is a healthcare provider and insurer based out of Pittsburgh, Pennsylvania. However, we have facilities and hospitals in several states and also countries. Right now we have about 92,000 employees. We also have about 40 hospitals and then 800 outpatient facilities and physician offices. So quite a large footprint right now.
And right here in Pennsylvania, you have a rather large footprint.
Yep, so in central Pennsylvania, we have 7 hospitals that are part of our system, which I oversee the recruitment for.
Most people, when they think about healthcare, they think about doctors and nurses, but there's a whole plethora of roles. I know at your hospitals you have maintenance staff, cafeteria workers, janitorial staff. But speaking of just the healthcare staff, what are some examples of entry-level roles in healthcare that you're constantly recruiting for?
So there's a lot, which is hard to believe, but not if you know the whole industry itself. We have patient care technicians, which are really vital in the care that we provide bedside to our patients that are inside the hospital. They work 24/7, they have various hours and shifts. We also have sterile processing, which is an important part of the surgical services kind of department. They make sure all of the equipment is sterilized and ready to go for surgery. So really without them, they can't go on in the operating rooms. We then have our patient services reps, which is a little bit different. It is still patient facing, but it's more like a customer service. They do check-in, check-out, and they're in our physician offices and a lot of our other outpatient facilities. Then we also have monitor technicians, which they are responsible for looking at the monitors, making sure heart rates and things like that are okay for the patients within our facility. So all of these positions play a really vital role in the care team within the organization.
If I were to start in one of the roles like patient care tech and then had a desire to move up a pathway, become a nurse, become a surgical technician, how does UPMC help facilitate that process?
Sure, that's probably an everyday experience for a lot of our employees. We have a lot of individuals that start as a patient care technician. Maybe they come in not knowing what exactly they want to do within healthcare, but they decide, I want to be a nurse after having some experience on the floor. So we have an excellent tuition reimbursement that we offer for employees. Some of it there's limited to no out-of-pocket expense, which is a big win for us. And so what they can do is they can work, they can get our benefits, take advantage of the tuition reimbursement. We even have career ladders in certain areas as they're pursuing whatever that degree is. So we have patient care techs that even go to become medical assistants, and then maybe they go to the outpatient side and decide, not sure if I want to be in the outpatient, so I'm going to keep on going with my education, and maybe they become an LPN, which our LPNs can work in our outpatient and inpatient settings. Then you can move to an RN, and you can do that with there's a lot of bridge programs from LPN to RN, which gets you to that associate's level RN. And then you can do one of our no out-of-pocket, I should say that, expense programs that kind of bridge over to the BSN, which would be the bachelor's in nursing. And then you can kind of move up from there to nurse leadership positions. We have a great nursing career ladder. So there's a variety of different things that people can do, certainly starting in one place and ending up in 5-10 years somewhere completely different as well.
So for students who are interested in getting a foot in the door in healthcare, let's assume I want to attend my local career and tech ed program, what types of roles can those trainings lead into to start my pathway?
Sure, quite a bit. So even the patient care tech position, we have a lot of schools that offer the nursing assistant training. You don't have to necessarily go through the certification piece, but we would hire because we would look at those skills that are learned in those programs. Those individuals are super valuable to us because they come ready to go. I think one of the biggest things with the career tech ed programs is that you get those critical thinking skills because you're mixing the academic piece along with the hands-on, real life experiences. So you kind of have to think of like, how does this all apply? And so when they come out, they're ready to go, hit the ground running, and then they can progress, like I said, through tuition and growing within the organization. So we really do value the education that's provided for sure.
So it sounds like if I were to go the traditional route, graduate, go pursue my, let's say, associate's degree in registered nursing on my own, I'd be responsible for that. But I could do a CTE program in high school, come in, work as a nurse aide, say, and then let you pay for my registered nurse program. So now I become a registered nurse, but I don't have the debt.
That's right. And you have the experience. So you're coming as a registered nurse with experience within the facility, working in healthcare, maybe even familiar with the department that you could become a nurse in. And so you're kind of ahead of those folks that go directly to school and don't get any kind of clinical experience and then coming into the workforce. Certainly both sides are important, but there's really value in getting that experience, and you get to see what that patient care tech role does. So then when you become a nurse, you really value the work that the patient care techs do within the facility. Same thing with our medical assistants. You can come out of some of our the programs that exist today and come to us, get a little bit of clinical experience, and move into a medical assistant position and work up that career ladder as well.
Awesome. And then I think it's also important that our viewers note, like as a medical assistant, I could work in a hospital or a physician's office. So there's going to be some differentiation between the hours I work, the schedules I work. And so that might be important to some people thinking about a healthcare career.
Absolutely. Certainly a different pace when you're looking at inpatient and outpatient to a degree, because I think now with our outpatient side of things, you're starting to see more, we're trying to focus on the patient and what their needs are. So maybe the hours are a little bit later, but certainly it's not the inpatient 24/7 care, having to work night shift, weekends, all of that, holidays. Outpatient's a little bit different where there's a little bit more flexibility. Maybe you don't have to work as many holidays, or you're not working overnight, you're not working every weekend. It might be a 4-hour Saturday shift. So there really is different paths, and I think it works differently for everyone. Depending on an individual, maybe the inpatient setting works because I need that flexibility, or maybe I can work 3 12-hour shifts and then be done the rest of the week. And, it gives me flexibility for my home life or family life. Or on the other hand, I need to work more of a traditional schedule because I need to pick up and drop off from school, or, those kinds of things. So maybe that Monday through Friday, maybe an occasional Saturday, that kind of shift works. So I think we do really have an option for everyone. And this is certainly just the clinical side. There's the whole non-clinical side of our organization where we have pretty much everything needed to run a business. And I think people forget about that sometimes, but certainly healthcare is the biggest face of our organization, and all those other departments really kind of help us to give that patient care.
When you talk about the non-clinical side, what are the non-clinical roles in a hospital and healthcare system?
Sure. So one of the biggest ones I can think of is just from a tech school is just the trades, and coming in and HVAC, and those that we can't function without any of those people that work in our maintenance department. I think sometimes they're the unsung heroes because they are behind the scenes making sure we have heat, we have air, things are flowing correctly, there's not an issue, things get fixed. And so when people come on board, there's that opportunity. Sometimes we also have like an auto mechanic, and again, there's not hundreds of them like there are nurses, but we do have somebody that works and does that kind of work within our facilities. And so there's, I think, just a plethora, let me say that word right, of positions and opportunities within. We've got the marketing side of things. We've got, individuals that work closely within a psych area, and I know that's more hands-on, but there's the office component to that as well.
Well, thank you so much, Shayla, for spending some time with us today. I really appreciate it.
Absolutely. Thank you for the opportunity.
Yeah.